Hi, my name is Bobby Holly. My part of the case study is subdural hematoma. We're going to be doing definition, description, and incidence. Here's my PowerPoint. Definition. Subdural hematoma is a collection of blood in the space between the outer layer of the dura and the middle of the meninges. It is the most often caused by torn, bleeding veins or the bridging veins on the inside of the dura as a result of blow to the head. You can see it's a blood clot or hematoma beneath the dura and the bone, and then that's the dura mater. Alright, description of subdural. Most often affect people who are prone to falling, work in the emergency room, and we do see this type of injury quite often. Only a slight hit on the head or even a fall to the ground without hitting the head may be enough to tear those bridging veins in the brain. There may be no external evidence of the bruising on the brain surface. Small subdural hematomas may not be very serious, and the blood can be slowly absorbed over several weeks. Larger hematomas can gradually enlarge over several weeks and can compress the brain, possibly leading to death if the blood is not drained. Most time we see some elderly patients with this because most of the time these folks are on some type of blood thinner. Okay. The time between the injury and the appearance of the symptoms can vary from less than 48 hours to several weeks or more. Symptoms appearing in less than 48 hours are due to an acute subdural hematoma. Most often this type of bleeding is often fatal. If more than 2 weeks have passed before the symptoms appear, they call this chronic subdural hematoma. The young and old are more likely to have a chronic condition or less risky. Okay, I got some symptoms of subdural hematoma presenting. Most times they have a headache, a contusion or confusion, change in behavior. They have some dizziness, lethargy or excessive drowsiness, weakness, apathy, and sometimes we see often seizures. All right. The incidence of subdural hematoma, about 1 out of every 10,000 people in the U.S. develop a subdural hematoma each year. Subdural hematomas are most common in elderly, also alcoholics, and often seen in some toddlers. This is my video. It kind of summarizes subdural hematoma. I'm going to play it for you here.
Acute subdural hematomas occur when outside forces, such as the impact from a motor vehicle accident or blunt force trauma, cause the brain to rapidly accelerate and decelerate inside the skull. Movement of the brain stretches the blood vessels that connect the surface of the brain to the dura, the sheet of tissue between the brain and the skull. These blood vessels are known as bridging veins. When a bridging vein is stretched too far, it will rupture, filling the subdural space with blood. This blood is now called a subdural hematoma. The subdural hematoma continues to fill the subdural space based on the rate of bleeding from the ruptured vein. Complications from subdural hematomas arise from increased pressure on the brain tissue, which can eventually lead to tearing of more blood vessels and herniation of the brain.
Thank you. That concludes my study.